Okay, so let's take a look at this situation here. So this is a patient who we've already completed. We did an All-on-6 procedure on this patient. We used zirconia, we used the Straumann VLX implant. But let's imagine as if this patient were to have ended up in one of these corporate All-on-4 practices. And I'm going to go ahead and place the implants as if it were an All-on-4. And so we'll take this implant here. I had to do a sinus graft, so we had to build the sinus up here. So the All-on-4 centers would not offer placing implants back here because it adds an additional cost, and you have to know how to do a sinus graft, and generally they do not. So the most posterior, the furthest back implant would go about right here. And it would be angled. Now I'll adjust the diameter so that it's more accurate as to what they'd probably use a 13, or I've even seen them use 15 millimeter implants. So here's the most furthest back implant on this side, and then the front implants would be somewhat like this, and we'll do it as if we are actually doing the surgery. And given the width and diameter, the 4.5 is about the widest you could place in this situation. Place a 4.5 by 13. And then we'll place so right now we've got 3 implants that are placed. And again, we'll go with a 4.5 by 13. And we'll adjust our angulations and put everything as if we were actually doing an All-on-4 procedure. And so if you can see here, this is where we'd have to place this last implant. Correct angulation, correct diameters, and lengths. Okay, so you can see now this would be a typical All-on-4. You'd have all of the implants concentrated in the front of the upper jaw. No support in the back of the jaw. And so they would have to cantilever this bridge all the way back to here in order to get to the second molar. Usually what they do is they stop at the second bicuspid. So you end up not having all of the teeth replaced with an All-on-4. Now notice on this side how far the cantilever would have to be. I mean, let's measure that, because there's something called AP spread. The AP spread is the distance between the most anterior or front implant to the most posterior implant. You multiply that by 1.5, and that will tell you exactly how far you can cantilever. And so if we were to measure this, and looking down here on a bird's eye view, so the green are the implants that were placed for the All-on-4. That's where you'd have to stop. So if we were to measure that AP spread from the most anterior implant to the most distal of the most posterior implant, that's 10.36 millimeters, or it's 10 millimeters. So the furthest you could cantilever back is about 15 millimeters. And so if we were to measure that, and let's say we were going to cantilever back 15 millimeters, it actually falls just shy of our most posterior or back implant. So that implant is critically important that it's there, because otherwise it's all of the load and all of the forces are back here on this back tooth, which in an All-on-4 case is a cantilever. It's an extension. There's no implant supporting it. And so this is the rationale and the reason why we at Trust Implants, it's so critically important that we do All-on-6 rather than All-on-4. But in order to do All-on-6, you have to know how to graft the sinus. So if this is a procedure that you're considering, if you're considering the All-on-4 and you've had a consultation, and if they're not offering you All-on-6 or more implants to support the prosthesis, get a second opinion. Because I'm showing you precisely why it's so critically important to have implants in the back of the jaw so that you can have support back there. Otherwise, you end up in a situation where all of the force is in the front and it's a chronic complication. The prosthesis is breaking, the teeth are breaking off, and so in reality, you end up with a situation where you end up with more problems, and you're trying to solve the problem of not having teeth and having teeth that you want permanent teeth. And so the All-on-6 is the solution for long-term success. Oftentimes we'll do All-on-8. We do whatever is necessary to over-engineer the case so that the patient has long-term success and is happy with the result. I'm Dr. John Willardsen, and thanks for watching.